Hip pain, that's what we're talking about today. I'm Dr. Barrett at Vibrant Life Center in Oakdale. Many people have hip pain, more common in women. As you get older, hips can go goofy, but before that, hips are really subject to what's going on with the musculature around the hip. And the musculature around the hip is controlled by your nervous system coming out of your low back. The nerves, individual nerves coming out of your low back. They run the ability to flex your leg up, put it behind you. So if that isn't lining up right, if one's not lining up right, your hip will bother you. Now, it can hurt on the outside of the hip where you touch it on the outside. It can hurt in the front of the hip and in the back of the hip. So different causes for all of those. Just if this helps you. If it's on the outside and the back, that's more likely to be nerve problem from your lumbar spine. If it's right in front, kind of in the groin area, and you're approaching 60, 70, that's more likely to be osteoarthritis of your hip. How do you differentiate them? We take an x-ray. We figure out what's going on. We look at the hip cartilage. We look at your pelvis. Could be your sacroiliac joint, which is right square in the back, a little to the right and a little to the left. The sacroiliac joint's right above that lumbar spine that controls the whole thing. So those are kind of the causes. Oh, last one, bursitis. You can have bursitis. That's on the outside of the hip, right where that hard lump is. You can feel that if you touch that bursa, if you will. And that gets inflamed if you have flat feet or knee problems, or you have sway back, too much curve in your low back. It changes how your hip articulates, and you get bursitis there. What do you do for that? Well, you actually got to work out the bursa. You got to work out the muscle that goes over it, the TFL, tensor fasciae lata, or the IT band. You got to stretch the IT band, all of which requires getting your spine checked and realigned so you get rid of the sway back. And if you have flat feet, find the other video on that. We're going to talk about that as well. So I'm Dr. Barrett, Vibrant Life Center.